For 20 years, ReAct has bridged science to policy and worked with communities to catalyze global action on antibiotic resistance, always placing equity, community voices, and the needs of low and middle-income countries at the center. Founded in 2005 by dedicated experts and advocates from different parts of the world, ReAct today has nodes in Africa, Asia Pacific, Europe, and Latin America. ReAct champions a simple truth. Global action is urgent. It must reflect the needs on the ground in countries. Towards this end, we work to ensure broad social mobilization on antibiotic resistance, local ownership of solutions, increased political will and accountability at all levels. From influencing local, national, regional, and global policy to engaging and empowering communities to take action with knowledge and tools, our work would not have been the same without you, our partners, allies, and champions. We are deeply grateful for your support. We look forward to celebrating this milestone with you and to continued collaboration in the years to come. A world free from untreatable infections.
Good morning, good afternoon, and good evening, everyone, and a very warm welcome. My name is Andrea Caputo-Svensson, Global Health Advisor at ReAct Europe, and I'll be your host for today. Thank you for joining us today as we mark a significant milestone, ReAct's 20th anniversary. Why we're here today is precisely because of the challenges that were highlighted in the video that we just seen. Antibiotic resistance cannot be solved by any one group alone. It demands a coordinated, whole-of-society response. And at the very heart of this effort is the power of community mobilization. This webinar marks also the launch of our new report, 2 Decades of Empowering Communities, which reflects on ReAct's 20-year journey of supporting community-driven solutions across the globe. The goal of our session today is twofold. First, to launch the report and present its key findings, showcasing successful initiatives like Antibiotic Smart Communities, the Alforja Educativa, youth engagement, and the From People to Leaders. And second, and most importantly, is also to look forward. We want to create a space to discuss what's next. How do we move from recognition to real investment? How can we build durable community-centered models that are locally owned but globally supported? In a second, we're going to have a look at the agenda for today, and we will begin with some opening remarks on ReAct 20 years journey. We will then present the key findings from the community engagement report, followed by a moderated panel discussion. We'll also have time for your questions, so please place your questions in the Q&A function of the Zoom link. And we will finish with some concluding remarks on the next step from the ReAct Funding Director himself, Professor Emeritus Dr. Oltokars. So stay tuned until the end. As I was mentioning, feel free to submit your question using the Q&A function, and if you want, you can also indicate who the question is for. In that way, it will help us to ensure to get the best answer. Now, it is my great pleasure to introduce our first speaker for today. To provide an overview of ReAct's incredible 20 years journey, I'd like to invite up Professor Murphy Mpundu, ReAct Africa's co-founder and founding executive director. With over 30 years of international leadership in public health, Professor Mpundu has been with ReAct since its very inception and has been a driving force in this work. Murphy, the floor is yours.
Thank you so much, Andre. I hope I'm audible enough. You can hear me.
You are.
Distinguished colleagues, partners, and friends, 2 decades when the world was only beginning to grasp the silent crisis of antibiotic resistance, a small group of visionaries chose not to just to respond, but to react. Under the leadership of Professor Oltokars, ReAct was born in 2005 with a simple but powerful conviction that saving antibiotics would require not only new medicines, but a new movement. As the saying goes, the future depends on what we do today. I mean, for the past 20 years, ReAct has been at the forefront of ensuring that what we do today, our advocacy, our science, our partnerships, our community engagement will secure a future where antibiotics remain effective for generations to come. From the very beginning, ReAct's strength has been its global teams network across 5, now 4 continents. Our multidisciplinary teams have worked at community, national, regional, and international levels, bringing the realities of the Global South into global policy dialogues and ensuring that global commitments are translated back into action where they matter most. ReAct is more than a network. It is also a verb. To react is to recognize a threat and mobilize across borders, across sectors, and across generations. And for 20 years, that is exactly what we have done. Connecting communities to policies, bringing local realities into global debates, and linking today's challenges to tomorrow's solutions. But ReAct also ReAct also really for us, stands for resilience, standing firm against one of the greatest health threats of our time, and keeping AMR on the global agenda, even when attention has shifted elsewhere. And then E is for equity, ensuring antibiotics are seen not only as commodities, but as global common goods that everyone has a right to access. A is for action, turning evidence into advocacy, policy into practice, and commitments into real world change. And C is for collaboration, working across continents and discipline, building bridges between grassroots voices and global policy platforms. And C is for transformation, because the fight against antibiotic resistance is not just about preserving drugs, but about transforming systems and empowering people and safeguarding our shared future. This is what it has meant to ReAct for 20 years. And along the way, we have shaped and contributed to shaping the AMR landscape in profound ways and influencing global policy and governance. ReAct, since 2009 and the AMR call in 2009, WHO's 2012 landmark report, to the Global Action Plan in 2015 that required every country to develop an action plan, to the UN Political Declaration in 2016, where the principles of the linkage in R&D and championed by ReAct was included. Members played a central role in the UN ad hoc interagency coordinating group, which delivered recommendations to the Secretary General in 2019 and contributed to regional frameworks such as the African Union's 2020 to 2025 AMR strategy and the AU Africa Union AMR landmark report, which elevated African priorities into global debates. Most recently, ReAct's evidence and advocacy contributed to the deliberations of the UNGA high-level meeting on AMR in 2014, ensuring renewed commitments on accountability and financing. And alongside these, ReAct has maintained a presence in the global platforms such as WHO Strategic and Technical Advisory Group on AMR, World Health Assembly side events, and FAO-led One Health initiatives, and the AMR multi-stakeholder partnership platform, always amplifying independent evidence-based perspectives from civil society and the Global South. And in advancing innovation, equity, and access, in 2009, ReAct worked with the European Medicines Agency and ECDC to publish one of the first comprehensive antibiotic pipeline analysis exposing the alarming lack of new drugs in development. And from there, ReAct championed a public health driven research and development agenda, including the linkage model to separate profits from sales volumes. This principle is now embedded in global policy debates and new initiatives exploring sustainable R&D. Beyond innovation, ReAct has consistently highlighted the lack of equitable access to essential antibiotics as a major global gap, advocating for pathways that ensure both innovation and access are addressed together, including integration into universal health coverage frameworks. And then supporting and implementing national action plans. And since the adoption of the Global Action Plan, ReAct has been a trusted partner in developing, reviewing, and implementing NAPs. We have worked with governments and intergovernmental organizations in implementing these plans in low and middle income countries. Building capacity and creating champions. ReAct has created powerful platforms for learning and exchange. Our annual conferences in Africa, for example, which began in 2015 with just a handful of countries, have now grown to include over 40 nations with diverse representations. Beyond conferences, ReAct has trained health professionals on stewardship, on IPC and surveillance, and partnered with professional associations to build technical capacity across sectors. Through these efforts, ReAct has created critical mass of AMR champions, youth leaders, health professionals, journalists, and policymakers who now carry the movement forward at local, national, and international levels. Empowering communities and civil society, lastly. Above all, ReAct has long understood that policies are only as strong as the people who bring them to life. Through initiatives such as Antibiotic Smart Communities, Alforja Educativa in Latin America, youth leadership hubs, church and faith-based partnerships, and the establishment of the One Health student clubs, we have shown how communities can shift norms, influence policies, and sustain behavior change. Our new report, 2 Decades of Empowering Communities, document these experiences across Latin America, Africa, Asia, and Europe, underscoring that sustainable progress depends on local ownership supported by global solidarity. Through all this, one lesson has been constant. Real progress is only possible when communities are empowered and when global solidarity supports local ownership. So today is not just a celebration of the past, it is also a call for the future. A call to sustain investment in community-led action, to scale up models that are locally owned but globally supported, and to ensure that the next 20 years of ReAct deliver even greater impact. On behalf of ReAct Network, thank you for being part of this remarkable journey. Together, let us continue to react boldly, urgently, and collectively, ensuring that the voices of the Global South remain central in shaping a truly global response to antimicrobial resistance. Thank you.
Thank you so much, Murphy, for that journey down the memory lane and listing all the excellent milestones that ReAct as a network has accomplished over the years. So thank you so much. I know the time was restricted. We would need more time, but it was a very comprehensive summary. Thank you so much for that, Murphy. And also for giving us hopes for the future, which is the most important thing. Now it is my pleasure to introduce our next speaker for today, my colleague, Dr. Maria Prenting, Scientific Coordinator at ReAct Europe. Maria was crucial to the realization of this report and will now provide an overview of the report key results and lessons learned. Maria, the floor is yours.
Thank you, Andrea. Just going to share my screen. So I have the pleasure to walk you through some highlights from this report. And having been with ReAct since 2014, I have been part of a little bit more than half of this journey. And social mobilization and collaboration with communities have always been a core of ReAct's work, as you also heard Murphy describe. That is because sustainable change starts with people. Communities hold vital cultural insights and lived experiences and can shape effective and sustainable solutions. Still, they are often excluded from decision-making, risking failed policies and limited impact of interventions. Including them instead helps ensure efforts meet the needs of people, have broader reach, and increased chances for lasting change. And for the past 20 years, ReAct has fostered a variety of community initiatives and efforts to mobilize civil society across sectors and continents. On this slide here, you can see just a few snapshots of that work to give a bit more flavor of the approaches we are taking. From reimagining resistance and dancing with bacteria to address the war metaphor in medicine, to convening the Antibiotic Resistance Coalition, the first global coalition of civil society organizations back in 2014. And although not specifically part of the report, each of these initiatives and that work is contributing to our collective knowledge and insights in the report. So in the report, we highlight 4 of our approaches a little bit more in detail that presents adaptable and scalable and impactful strategies where communities have a key role. Antibiotic Smart Communities in Asia Pacific, Alforja Educativa in Latin America, youth engagement activities in Africa, and From People to Leaders, a global effort coordinated from ReAct Europe. And I will provide a short overview of each of these. The Antibiotic Smart Communities project was initiated by ReAct Asia Pacific in 2018 to address the need for bottom-up approaches in implementing national action plans on AMR. A 15-indicator framework was developed to help communities assess preparedness to address AMR across the One Health spectrum, covering areas like sanitation, farming, and stewardship. The framework has been piloted in 6 communities in India and 2 in Indonesia, and was found possible to apply in these diverse contexts. And in one community, a 12-activity action agenda was co-created with local stakeholders, including activities such as training school children on soap making and other antibiotic smart actions. Some of you can see here in the pictures. And the project has engaged a large number of community stakeholders, and several civil society organizations have begun implementing parts of this framework into their public health programs. Moving to the Alforja Educativa, which is an artistic educational tool designed to promote health and environmental awareness and support teaching and learning about bacteria and antibiotic resistance. It was initiated in 2012 as a joint effort between the Child to Child Center and ReAct Latin America, and was developed by an interdisciplinary team of teachers, health professionals, scientists, communicators, and artists, with active participation also from children. And an alforja, or saddlebag, is a cultural identifier within the Andean culture and can also be seen as a metaphor for seeking balance in nature. And the Alforja promotes meaningful learning in children through play, art, research, and the sharing of learnings with families and communities. And the Alforja has now been used in training sessions with 700 teachers and 3,000 university students, who in turn have trained more than 7,000 children in more than 200 primary schools. And it has expanded from Ecuador across Latin America and also to Kenya. A study with 980 children demonstrated significant improvements in children's knowledge after participation. And the Alforja has also been officially recognized by different authorities. And in ReAct Africa, work with youth has been crucial since its inception in 2014. And the program's overarching goal is to equip young people in Africa with tools to contain antibiotic resistance and supporting Africa's youth as global change agents. And through activities such as the AMR Leaders Program, the African Youth AMR Alliance Task Force, and student clubs, students are empowered to become champions of antibiotic stewardship. And to date, the program has engaged many, many hundred students, have also moved on to starting their own initiatives, engaging other students and youth and their communities. And some also and take part in shaping national AMR plans as youth representatives in these processes now. And finally, with the From People to Leaders Act on AMR Now initiative, ReAct worked to elevate grassroots voices at the UN General Assembly high-level meeting on AMR in 2024 and helped secure recognition of community engagement in the UN Political Declaration. ReAct worked with the Pan American Health Organization to co-facilitate consultations with communities and civil society to formulate the 10 asks to member states, which also now appear in the call for action. And the campaign mobilized more than 800 endorsements from 85 countries, including support from over 200 civil society and community groups worldwide. More than half of these were from low and middle income countries. And these signatures were then handed over to member states' representatives in New York just days before the high-level meeting. Some overarching learnings from these initiatives and 20 years of engagement is that trust is really fundamental and can be built through transparent and participatory processes, which also helps drive ownership and sustainability. Context is important, and strategies must be culturally adapted to be relevant. And creative communication can help break barriers, and by using art and stories and play, you can reach further. And finding these pathways to sustainability is key, to, for example, through integration into community programs. But funding is a large challenge, and long-term flexible support is needed for driving action locally and for the support along the way. And I'm ending here with some additional images of some of our fantastic community collaborators, and invite you all to read more in the report. And with that, I hand back over to you, Andrea.
Thank you very much, Maria, for that excellent overview and really showing also different pictures, different sides of our work. It was excellent overview and showcasing of the work of over the last 20 years. Thank you. And you also given us a lot to reflect on, and I hope also inspire others to really find those synergies with the work that we've done and to move it forward. I also want to mention that both Maria and Murphy will be connected until the end of the meeting or the webinar. So please, you can also ask questions to them using the Q&A function. Now we will actually turn to our experts and community representatives to hear the reflection on the ReAct work. And most importantly, also their vision for what needs to be done in order to move forward. This next session will be a dynamic discussion structured in two parts. The first part reflecting on ReAct's 20 years of community engagement, and then the second part instead on charting the path forward. So from awareness to system change. Again, please ask questions in the Q&A. We will collect them, and after this session, we will ask the experts a few questions. But before that, to guide us through this session now, I'm delighted to hand over to our ReAct Europe Director, Anna Sjöblom, who will introduce our esteemed panelists and moderate the dialogue. Anna, the floor is all yours.
Thank you so much for this introduction, Andrea. And it's truly an honor to be here together with you all today, and to also introduce and moderate not only one, but two distinguished panels. And it's really as an aspiration for us to touch base on many different aspects of community action and people's engagement, and have a really broad palette of work, which have given us also having this quite short format when it comes to the panel. So with some help from you, Andrea, for us to keep track on the time, I will now introduce you to the first group that will help us. And here we will now have a look at ReAct's work over 20 years of community engagement, and also some comments on the reports. So the group that will take us through this is, and you can put on your cameras now, friends, it's Mario Medigan, a public health physician, Secretary General of Musum, and CEO of HECA Public Health Services. Mario has designed and led initiatives to improve the living conditions and health outcomes of vulnerable populations across Africa. Mario was also awarded the AMR Champion of the Year at the ReAct Africa and South Center Conference in Lusaka in June this year. Bonjour et bienvenue, Mario.
Merci.
Speaker to come up also, and I'll introduce the full panel now, is Florence Anam, a global advocacy leader in the HIV response and currently the co-executive director of the Global Networks of People Living with HIV. Florence holds a master in communications and a bachelor in business administration and have worked in many different initiatives over the year. Welcome, Florence. And Rebecca King, next panelist, is an experienced professional in the international development sector on livelihoods, food security, and health programs. She has worked in South Asia, and West Africa, and is a professor in global health and community engagement at the University of Leeds. Welcome, Rebecca. And last but not least, Philip Matthew, a public health physician working as a technical officer within AMR Awareness Campaigns and Advocacy Unit of the WHO headquarters. And previously, he was part of ReAct Asia Pacific team. So welcome to you, Philip. And of course, we're very curious to hear your reflections of this report that is newly published and that has been presented with a sneak peek at ReAct Africa Conference and at the ReAct Asia Pacific Conference. The first question to all speakers actually, was there anything in particular that struck you from the presentations in the report, any particular project approach or aspects of ReAct works over the years that you like to comment on? And I'll invite you first, Mario, to give your reflections.
Okay, thank you so much, Anna. And thank to the whole ReAct team for inviting me to this panel. And yeah, I'm very familiar with most of the points that have been raised in the report, and precisely that's the striking fact that the inclusiveness of the approaches that the network may make sure every time to bring everyone on board, to co-create the approaches and the intervention with the different stakeholders from the very grassroots level. And also I would say the visionary leadership, because at the very early stage, we could notice the importance, the role ReAct attributed to the community from a very early stage. 10 years ago, it was my first time, my first ReAct Africa conference was my first time hearing about One Health, concepts like One Health, and today I'm able to efficiently advocate for those topics and on the behalf of the community I work with. So that's exactly the striking point, the inclusiveness, the whole of a society approach, and make sure every voice is are taken into account. Over to you. Thank you very much, Ivana.
Thank you so much, Mario, for sharing those reflections. And Florence, you come in from a little bit different field, but so connected to the work that ReAct is carrying out. What are your reflections on these examples of the community engagement projects and the report and ReAct's work?
Thank you so much, Anna. And first, I have to start by congratulating ReAct and you all for the wonderful work. It's so inspiring to see an attempt to definitely bring together 20 years of work into a slide deck. And I think you've tried your best, but I believe there's so much stories in the slide deck we've just seen now. Congratulations. I think I'm inspired by many things in the presentations I've had so far, coming from the community. As a community organization, GNP Plus is led by and for people living with HIV, so resonated a lot with that. I will speak to two things that I think caught my attention. And the first one is the Smart Communities project, because of its intention to primarily do a bottom-up approach. I think on our end at GNP Plus, we call it local for global people living with HIV. led advocacy. And I think that's needed now more than ever. And I'm inspired to learn more from how you're doing it, because as national governments take on stronger leadership role of their health programs, as donor funding from the global sphere is constantly reducing, it is important that localized advocacy by communities is supported, and it feeds into the global piece of work. From people to leaders, love it. I love the movement building around a particular piece of work, particularly around the HLM. And I think for me, it looks at how you can institutionalize movement building into advocacy for change that can create aspects at the global level that will impact at country level. So those are my immediate reactions to what has inspired me from your work over the last 20 years. Thanks.
Thank you so much, Florence. And we'll come back to you also with, looking forward on what we can develop more. And now I'd like to invite Rebecca. You come also with an academic angle, but not only having actually worked in different projects also in global health here. So what are your main observations and highlights from this report and this work?
Thank you. Like the other speakers, I'd like to start by saying a huge congratulations for all of this work. It's really inspiring, and it resonates very closely with the work that we do in our team. It's quite familiar in a certain way, lots of similar kind of thinking and concepts and principles, but very unique as well, looking at these 4 projects. And I had some sort of broad observations that I found very, very interesting, very inspiring. So one was noting the just wide range of stakeholder types that are engaged across these different projects. So ranging from local government, farmers, school children, students. So that was really exciting, a whole society approach. And also we've talked about inclusivity and bottom-up approaches from other speakers. So that was really excellent to see. Another thing that I really appreciated, because it's something close to my heart, I'm a social anthropologist by background. In the Alforja project, I really liked the incorporation of Indigenous knowledge and this recognition of the interconnectivity of all beings. I really liked that was at the heart of the project. I saw a really strong emphasis on One Health approaches across the projects, which I think we're all aware is very important when we're tackling AMR. So those were some sort of general points around the values and principles. I appreciated all the lessons that are mentioned around participatory design, adaptation, partnership, creativity, etc. And then I guess from maybe perhaps an academic perspective, certain things leapt out to me. So one was the implementation gap, which perhaps we'll touch on more. I found it very interesting. It was mentioned in the report in several places. So the gap between policy intention and implementation, and what can we do about that? And the other thing that I noted is really around the call within the report for further research. I thought it was interesting to focus a bit on adaptation, implementation, and costing. So those were the things that I noticed. But thank you.
Thank you so much, Rebecca, and excellent points also to take with us in the forward-looking discussion as well. So last but not least, Philip, also having worked both within one of these projects and also outside of ReAct, what are your takeaways?
First of all, thank you so much, Anna, for this opportunity, and congratulations on the remarkable report. I think all the 4 projects are remarkable and truly innovative, and it kind of shows the catalytic role that ReAct has played in mainstreaming AMR in different geographies across the world. So, for example, ReAct started doing community engagement and working with youth much before these became global buzzwords. So that kind of shows the leadership that ReAct had. But for me, if I want to pick one, the one that stands out was the People to Leaders Act on AMR Now. I think that amplified messages from grassroots in the run-up to the UNGA high-level meeting on AMR. I think all of us need to acknowledge that AMR action is still very top-heavy. Many of the narratives and decisions are influenced and heavily influenced by global actors, and there is no real system to capture inputs and insights from community setting. and use it for policy formulation purposes. We are yet to see the kind of civil society mobilization that we have seen in, for example, HIV or TB or even maternal and child health. So one part of the problem may be the complexity of AMR and the challenges involved in communicating it to all the stakeholder groups. I think Professor Otto has been, repeatedly saying, how we need to frame this very well. But that being said, I'm happy to see that this particular People to Leaders Act on AMR Now initiative attracted more than 800 endorsements, and that too from 85 different countries, and half of that came from LMIC civil society groups. So that level of mobilization is remarkable, and it showed that communities care deeply about AMR, and their insights are also essential in shaping AMR solutions. And this is very powerful because it reminds people, especially the policymakers, that AMR is not just a technical challenge. It is a human one. It's a deeply human one, demanding equity, accountability, and as UNGA high-level meeting political declaration say, a whole of society approach. For me, I think this is proof that sustainable action against AMR will be possible only when the people who are affected are not just consulted, they are leading the conversation, they are a part of this conversation. I think I feel, and because the personal feeling, I feel among all the different constituencies, civil society is a low-hanging fruit, and ReAct should be able to continue taking a leadership role in mobilizing them. And just to say that as for WHO, we are about to launch the WHO Civil Society Task Force on AMR with 81 members across the world. We also have the civil society cluster of the multi-stakeholder partnership platform. But the true metric of success will be to have such engagements and mobilization replicated at a national or even a subnational level. So if it happens at a global level and people come together for a few conversations, it's not going to work. We have to replicate this at a regional, national, and subnational levels, and only organizations like ReAct can do it. Back to you, Anna.
Thank you. Thank you, Philip, for these observations, and also a little bit already forward-looking, which is excellent, because I mean, in this work of both turning 20 and writing report, it's to capitalize, but and to show also the work we've done. But it's even, I would say, the most important part is of course what happens next and the next steps, both for ReAct and for our community, I would say, in making sure that change come from people, and that we bridge this implementation gap. So that's what we're going to talk about now. But first, I just want to also thank you for the congratulations, and if all the colleagues online now that have been part of this project, this is really for you all. So thank you for that. But for ReAct, we have piloted, as you've seen, different approaches. But looking ahead, what should we take as next step, more concretely there? So here, Rebecca, I invite you in first. I mean, based on experience from different regions, what role do you see for community, civil society, and ReAct going forward from here?
Thank you very much. So I've divided my answer into two. So I'm going to start with the community and civil society, and then ReAct, obviously very interlinked. And with regard to communities, I work in community settings as well, as mentioned, and I think that two of potentially many very important roles for communities are around the co-design of interventions, policies, approaches that we use to address AMR, and around advocacy, which I think are both things that we've seen across these projects that ReAct has delivered already. In terms of co-design, I think one thing that we can be thinking about in community settings is furthering and developing our understanding of community. So we are working across multiple dimensions, across multiple stakeholders, etc. But all of us are part of communities. And so one area that I've been recently thinking about is how can we incorporate the linkages between lay people within communities and those who provide and prescribe and sell antibiotics to us. So really thinking about other layers of stakeholders and how we can co-design interventions and approaches together. The other side, of course, which is so important and is so central to ReAct's work, is around advocacy. So bringing that evidence base into conversation with lived realities. So when we talk about the top down, as Philip has mentioned, the evidence-based policies and interventions, how can we work in community settings with community-based stakeholders to think through how we can develop interventions and approaches that work within those contexts and that are tailored and adapted. So those are my two themes. But for ReAct, I obviously have known about ReAct for a long time. I've been in touch with you for a long time, but this report and the presentations as well have really brought home to me what a powerful force ReAct is and what an extensive global kind of body of action ReAct has. So I think ReAct's future is that really the role is around this advocacy, this policy, this influence, this innovative interventions and impact. The role is absolutely critical in terms of amplifying voices and creating partnerships. And there's just so much potential to continue this excellent work. It's an extremely important role. So I look forward to the next 20 years. Thank you.
Thank you, Rebecca. And same question over to you, Mario.
Okay, thank you so much. What I realized over the years, and with such a comprehensive and insightful report, now that we know what community needs, we know what are the challenges we face on a daily. And now we can't say anymore that we don't know what's going on. Now that we know all that, how do we translate this point into tangible action in the field, Also, how do we, if the narrative, for over the years, from my experience at least, the communities are considered as beneficiary, almost all the time. So now, how do we shift from that narrative and empower our communities enough, build enough capacity in our community so we can take ownership of our own health condition, and reports like this, not just extend this report to the decision makers at the central level, but also become actors of implementing the findings of these reports. So for me, next step, this is what we should try and implement. How do we take action ourselves at the community level, not necessarily wait for anyone anymore, mobilize our own resources, build capacity within the community and start doing something at our own level. Yeah, that and keep the same energy we had over the two last decades and the same mindset and see what we can do at our own level. Yeah, thank you.
Thank you, Mario, for those observations. Very important. I heard, capacity and resources would bring us also to, necessary policy change and integration of this. So I'd like to turn to you now, Philip. How should we go about integrating these models into policy and funding stream, also given, how the world looks like right now and the very big geopolitical changes that we are seeing and that we are, that will continue?
I think that's the most difficult question, and it's a very challenging external environment, and we have to acknowledge that, and we have to be realistic in what we aim to do. And but then we should realize that not everything needs money. We can actually bring about a change in attitude. Policy change doesn't essentially mean you pump in a lot of money to see something being changed. That being said, I think what this particular report makes it very clear that community-driven models are not nice to have one. They are essential components of a global AMR response, and we have to approach it that way. And I think the million-dollar question is how to wire them into the policy and financing so that they are scaled and they last. And reflecting on what Mario just said, there is a gap. So communities and these kind of community engagement exercises are seen as more giving something back to the beneficiaries. No, they are being a part of the co-creation, and we have to do it together if this is sustainable and if the global AMR response has to be successful. I think the first point is to build community leadership into AMR governance at a national level. I think national action plans need to formally reserve seats for community representatives, youth, your patients, community leaders, farmers. None of them ever have to ever get to actually give their opinion on AMR committees or technical working groups, and this has to change. If we have a modest and a dedicated budget line for their participation and capacity building, this can work. And I think the report is also quite explicit, to show that institutionalizing community and representation is a must do kind of a thing. It's not a good to do kind of a thing. So we have to work on it systematically throughout the world. I think the second part of my response is finance what we can measure. The Antibiotic Smart Communities indicator framework. We constantly refer to community engagement, but how do you objectively measure it? So I think the 15-point indicator framework is a response to that, and this can let governments and donors quantify what do you mean by antibiotic smartness and what is the metric of success for community engagement, and we can even track scores over time. To quantify and see whether money has been successfully utilized or not. And the piloting done in India and Indonesia, it shows that these are adaptable tools and it can actually demonstrate improvement. And that is exactly what the funders need for a results-based disbursement of money. So we have the tools ready. The third is how do we hook these community models onto existing pooled funding mechanisms instead of creating new silos. For example, UN General Assembly high-level meeting calls for a whole of society approach. We can use the policy mandate to require community engagement components in proposals for MPTF, the Multi-Partner Trust Fund, or the pandemic fund grants, or any AMR One Health programs of the World Bank. So again, we can try to build in community-led monitoring and incorporate a couple of community level indicators into the whole framework. And this has been done in other contexts, in other disease verticals also, TB and HIV, for example. And lastly, I think creating
a very short lastly,
yes.
Philip.
I know, because you're passionate about this, you tend to talk longer, but create accountability mechanisms that travel upwards. We should be asking for public progress reports on AMR targets that include community generated narratives and matrices, which again aligns with the UN General Assembly high-level meeting, and we can learn from others. For example, climate change, which is equally complex, and there should be some cross-fertilization involving climate change and AMR to inform what we are doing. And if we are able to do it together, all of this together, I think these models stop being pilots and it will start becoming policy. Back to you.
Thank you so much, Philip. And Florence, I'm going to ask you the same tricky question on how to move forward and integrate this in policy and in financing. I think you will have also like coming in with a different perspective here. So please go ahead, Florence.
I think the big thing right now, and just bringing in lessons from our HIV side, is we are witnessing from the geopolitical changes and the funding landscape a need to reshift our thinking, particularly from the community side and also from the patient aspects as well. And I think I want to just use that to say two things and what I think is a contributing factor. So I think one way we must begin to do this, well, of my two things, I want to talk about institutionalization of our community work into processes and government structures. And I want to also talk about the component of self-care, just to build up a little bit on what Mario just said. So I think at the moment with the funding landscape shifting and discussions taking on a broader bilateral government to government conversations, I think the risk of community being kicked out of these processes is glaring and immediate for us. So how do we organize ourselves to not be out of the room. And I think we have to go back into the countries within which we live and figure out what mechanisms exist for financing, for finance planning and discussions. We have felt challenged as people living with HIV with full knowledge of what to do with the US government HIV financing process. We know that at the tips of our fingertips, but we don't know what our finance processes looks like at country level with our budget making process. So can we use those opportunities to fully understand how we can be able to negotiate within that which is closest to us? I also do agree that not everything requires a lot of money. I think there are ways to figure out how to mobilize at particularly grassroots community level. And this can happen if we are able to build within institutionalized structures administratively as well. In terms of self-care, I think that reshift and mind change within us to understand that we are the agents of our own change and we are the owners of our own health. I think building on self-care practices and working towards promoting education and tools that can support that would be important. For these two to work though, something that I saw in your report is that trust building is critical. It is really critical. It's critical to build trust. It's not been existing, particularly with governments in many spheres, but we have to move forward and be willing to build that trust as a core component, but also trusting that patients and people can be able to make decisions, and using that as a foundation for building self-care would be useful. Yeah.
Thank you so much, Florence, for those. And that was actually the ending words of this panel. But I'm sure that we will actually be able to learn so much more from also your network and your work, having been pioneers also as patient advocates and the self-care aspect as well. So we'll surely come back to this discussion. And I would like to thank the whole panel. And we're going to quickly switch over to the next set of here. From awareness to systems change. So I have now, and I've seen actually there's quite some activity in the chat. So keep on writing. And also if you don't have a sit with a question, but want to, share a reflection, please do that. We will collect them. We will not have the time to go through it all in this session, but it's really valuable for us. So here, now I have the honor to introduce you to Catherine Urbais, the founder and executive director of the Health Diplomacy Alliance. And Catherine has a long experience in diplomacy in global health, human rights, and humanitarian affairs. I'd also like you to introduce you all to Katie Wright, who is the director of Global Fund Advocates Network, GFAN, leading global health advocacy and coalition building. She drives grassroots and international efforts to influence different institutions in this field. I also have the honor to introduce you to Nafis Faizi, who has a strong background leading initiatives regarding AMR and currently is an India HPSR fellow and academic editor of PLOS Medical Public Health and a medical doctor as a background. And also I have the great honor to introduce you to CEO Onebushi Shuku, former Minister of Health of Nigeria, and also a professor of orthopedic surgery and a member of the Global Leaders Group on AMR, as well as the chair of Nigeria's National AMR Community of Practice. So welcome to panel number 2. And the first question that I will direct to all of you, Katie, you can start off. I mean, building on the first panel's observation, and this is a very broad question, so you can choose how to go about and tackle it. What is needed, really, to build durable, community-centered models that are locally owned, but globally acknowledged, interconnected, and designed for replication? Please, Katie, the floor is yours.
Thank you, Anna. I guess I would say that my personal big takeaway from ReAct's 20 years is that, local legitimacy and global solidarity are not in conflict, and that they do strengthen one another. Local leadership gives credibility to global advocacy, which is sort of where my heart sits. And what we try to do as global networks is bring resources and protection at times back to local action. And durable models really start with community leadership. And I think your report just so beautifully portrays how the work of ReAct has been able to do that and grow over the last 20 years. But these models kind of last best when people who are most affected are not just consulted or even meaningfully engaged, but are actually part of setting the priorities and holding systems accountable. At the Global Fund Advocates Network, or what we call GFAN, the core of our work, as you might have guessed, is around global fund policy and resource mobilization, but it really is so much broader than our name would suggest. One thing that we have focused on is how we make space and center the people who live and work at the local level or are benefiting from global fund programs or funding in the conversations that are happening in donor capitals or at the Global Fund board or in big forums like large international conferences, high-level meetings, those kinds of things. And for about a decade now, so only about half as durably as ReAct in its work to build capacity and champions, we have supported individuals who benefit from Global Fund programs as sort of effective spokespeople for the Global Fund and what we've called our Speakers Bureau. And we provide them with media and spokesperson training, information, intelligence, so that whether they're seated at a dinner beside a minister from a foreign country or on a stage with a president or a prince, or meeting with members of parliament or on a TV talk show, they are as at ease in the same way they have been in their communities where they're the ones leading peer support networks or conducting community-based research or leading organizations that support key and vulnerable populations within their communities. But something that we've been reflecting on more recently, I guess, is that the language and the words we use to describe concepts and enact our campaigns are so often as important as the message or policy we're trying to articulate. And it really is rare that input from communities is seen and presented as expertise and received with the same weight as other more traditionally seen experts. And so at GFAN, we've been collaborating with partners on what we call the White Coats campaign over the last year and a half or so. And white coats, that you might see medical professionals like doctors or pharmacists who are so important in the AMR conversation. Those white coats imply and confer expertise in a way and at a level that community expertise is very rarely seen. And it's not that storytelling or engaging and consulting with communities and even community leadership are not important parts of the whole picture. It's just that we're trying to use a little bit of different language right now around experts and expertise and with our campaigns to reframe the discussion a little. So I know earlier Maria said inclusion is not optional. And we believe that it's really important in our existing systems, as Philip was talking about earlier, about ensuring that we add metrics and indicators around community engagement. That is important. But, we don't have metrics about doctors or pharmacists being included usually, but about the results that their work delivers. And we need that shift for community expertise in sort of the broader conversation so that community expertise and engagement is not a KPI to be met, but are already in the room and designing what success looks like, whether it's something new or something that's existed for a while. So I think I've gone over my time because I see Andrea's lovely face. So thank you.
Thank you so much, Katie. We'll come back to you. And now, Professor Shukwu, it's time for you. I mean, also you are part of this work on really the global leaders group level as well. What are your observations? What is really needed for us to build these models and to get really somewhere with this work?
Thank you so much, Anna. And as you've earlier mentioned, along with other panelists who spoke earlier, we need to congratulate ReAct network for what it's been able to achieve within 20 years. And I guess the acceleration will be even better. You are going to achieve double within the next 10 years. Truly, the principles are things that are currently being advocated through the political commitments made last year at the high-level meeting at the UNGA. It's also something the high-level ministerial meetings have adopted. It's also something that those of us working on the Global Leaders Group on AMR have considered priority. And so engaging the community is key. Engaging the community in terms of awareness, which has been achieved largely in many areas, but still lacking, I must say, in many parts of the world. And then moving on to implementation. So the main thing is that the same way we got communities to become aware by including them even in trying to set the objectives of any of the programs, in involving them to set objectives in terms of what their expectations are, is the same way we're going to do with implementation. So definitely we must have an inclusive approach continued. And inclusive approach means that we must have those who are going to drive the process. So having passionate leaders with capacity who are so enthusiastic to drive each step of the processes will be very important. Now, at the local level, we must understand what is the cultural background of the people. For instance, in Nigeria, most people do listen to faith-based leaders. So it's one thing in a place like Nigeria to use the faith-based organizations for these community-owned processes. These are people they respect. And the same thing with the traditional kings. Nigeria, for instance, is now a secular republic, but we still have small communities that have traditional rulers, kings in their own right. And they do command so much respect from amongst their people. So we must engage people like that. Then finally, at this segment, the other thing I have to say is that we need to decide to set what targets. There's no point getting involved in activities. We must talk more about impact. So what has been the impact of the awareness creation, for instance? Why did we not measure up to 100% in terms of targeting? So we need to have clear-cut objectives so that eventually we can measure our output against what the objectives we are in the first instance. Thank you.
Thank you so much for these observations, which I think is also very good to come back to, like also how to create that political will and what is actually people listening to, as well as connecting these two worlds with each other. So now turn over to you, Catherine, and you also have worked in diplomacy sphere a lot. So what tools is in your toolbox to get where we need to be with making these models and this work also both locally owned and globally acknowledged?
Thank you, Anna, and thank you for this lovely webinar. I echo everybody to, first of all, congratulate everybody in ReAct for the 20th anniversary and for putting a forward comprehensive report. I would like to first emphasize, and if we take some of the examples that I already have made of the programs that ReAct has done, I think the people to leader is the reflection of how you bring that into local, I will say, local actions. So we understand that communities must design and should be leading and bringing this legitimacy of the work that they know, the knowledge that they have, to shape not only at the local level, but national, regional, and global. And this has already have been mentioned. And if we look at the report, even some other kind of projects like the Alforja Educativa that you have been locally building in terms of educations and to bring this misconception and light of education is something that uses diplomacy as a way to really break the barriers and use education to seek that relationship. And this is something that you've been doing at the regional level and being scaling up. That's pure diplomacy in somehow. So we congratulate you on that things. But if we look at the diplomatic integration, we have to understand that there are foreign policies process that are happening that requires more formally community engagement and inputs in terms of AMR, not only on the governance, but in the implementation and the policy implementation. And I think this is one of the beauty of the work that we do, is trying, when this diplomacy kind of global scenario is trying to bring the perspective of what is called track 3 diplomacy, brings the community diplomacy, the know-how that ReAct has been well known for doing that, and being a leader to bring in this community perspective. Other than that, is we really need, if we have to look at the positive things that are needed to integrate that, we need to create structures and pathways that are formalized. We were talking about bringing community to the table, but if it is not in the table, that in the table, the discussion is based on the community work. So we bring that discussion there, and you have done that quite remarkable in terms of integrating community work, including some advocacy efforts for the last year political declaration and some other regional initiatives. And also, as we see today, there is going to be discussions of the political declaration related to NCD, and there is limited text, I will say, in terms of antimicrobial resistant, but somehow it is good that it's being recognized, some of the aspects of the prevention and the equity perspective that community needs in terms of antimicrobial resistance. So there are many other diplomatic frameworks that can be replicated and that can collaborate and link these cooperations and lesson learned across borders. And that means from education, from policy implementation, design, co-design, but I think the sense is to bring and translate what the knowledge of the community and use frameworks and structures and pathways that would allow to have this local impact in AMR. Thank you.
Thank you so much, Catherine, for those observations and also like how we can use diplomacy as a tool. And now over to you, Nafis, and also like perhaps from diplomacy to advocacy, or the merge of the two. What is your takeaway on like the actually key things needed in order to get these models more known and implemented, as well as, replicated?
Yeah. Oh, well, thank you, Anna. It was nostalgic to see how much we've come in 20 years, and there's so many programs that we don't get a time to talk about. So for the community-led knowledge, in a world where bizarre claims like paracetamol causes autism is gaining traction, we must confront a deeper issue, which is that our health systems are very poorly connected to people and their realities. So what happens is that so I've got 3 points. Number one, our discussion has to change into a dialogue, because we've constantly built a system, and I'm not talking about ReAct or welcome-led projects, but we've built systems that speak to, or at best at, the communities, not with them. So the dialogue has to start, and this disconnect is worsened through tokenistic engagements. It gets worsened when disabled primary systems are there, and it's a poorly framed conversations go on. So instead of asking why do you misuse antibiotics and telling them more about it, we should have been asking the question, how do you navigate your infectious diseases? And this tells us that, because in antibiotics it's both overuse and underuse is a problem. So we are not going to understand unless and until we stay with the people. I also would point, number 2 is we must challenge the normative narratives, because there is a very technocratic framing. I think Philip also talked about it in the beginning, because we cannot constantly ignore the structural realities of the people: poverty, exclusion, lack of access, that shape antibiotic use very, very well. I think ReAct already had a report many years ago on access versus excess, and that still needs to be there at the core of our work. Because if the system is absent, unaffordable, or unwelcoming, people don't have choice. And if you want to start a dialogue, you'll have to change that. Finally, the 3rd point is the paracetamol lesson. And I know that others have talked about it, but my point is that civil society organizations who had a seat at the table during COVID, they ensure accountability, they hold their whistleblower role to counter unsubstantiated claims by state, by private actors. They call them into account. They must be back at the table like they were during the COVID.
Thank you, Nafis, for that. And great to for us to be reminded also that we're part of, also somewhat an attack on science in the time that we live in. So yes, time is flying. I'm gonna let you in one more time and actually hear both, actually share if there's anything that you have on mind also, like key takeaway for the future. And I would also like to throw in the word of, partnership. We're all part of communities, as you say. So what will we then, how can we use that and build new partnership that will then also lead to this better integration? And I'll let Catherine start this time.
Thank you, Anna. And I think it had been said, and I think the reports put it out together in terms of the next steps and also the partnership that it needs to be brought forward. I think we have to look at what are the current gaps that we have and how we establish these kind of mechanisms to establish partnership. We understand that there is a need to include donors, and the donors driven should be focused on not bypassing sometimes community priorities. So that there is a lot of work that we need to do that. The global coordination, so more work in terms of global coordination, especially when there's fragmentations that persist in terms of antimicrobial resistance at the governance level and at the financial level. And then if we look at the need of changing institutional community-based funding models. So that is something also that has to be implemented. We are going to see a process of an independent panel, how that community comes into place into the discussions, not only to be on the table, but to bring on that. So we need to build that coherence and collaboration into that. As I mentioned, there is a lot of process of negotiations that are coming. So how we foster these collaborations with governments and use foreign policy, I am biased on that, not only to secure donors' support, but also to ensure that all the commitments that we have somehow put in our paths comes as a front of implementation, and there is accountability for it. So there are many initiatives in terms of initiatives and really pathways that we can do to collaborate, to bring in this financial architecture that is needed, the partnership legitimacy of communities, and also what it makes it in terms of what is happening at the multilateral level. And I think if you look at your report, there are many aspects that are quite interesting in terms of the work that you have done in youth in Latin America. That's also in terms of amplifying this kind of diplomatic convening, and also the community work that you've been doing with dialogues on antibiotics in Africa and in some other regions. So this partnership should continue, not only for the global actions, but also how at the regional level best practice can be shared. Thank you.
Thank you. And thank you for mentioning the youth as key stakeholders here and key parts of community. Katie, your last takeaways?
Yeah. So, I mean, I think in terms of partnership, right, the most effective partnerships are, they're multi-layered, right? They link local resources with regional coordination. It's backed by global solidarity, and it's supposed to be this lovely virtuous cycle, similar to, I think, what maybe you were speaking about before. And I don't feel like I have an answer myself, but we keep having these future of global health conversations, or at least in, where I sit, they've become this very big part of all of our conversations. And I'd like to return to that if I have time, but I am timing myself. But I do think that where networks like ReAct and GFAN have, very similar, we might work in very different fields, and I don't understand how to answer any of the questions that are currently in the Q&A. So I hope somebody can, because I don't have any expertise in AMR myself, but we do share similar missions, and we do, the work that we do is underpinned by very similar values, right? And that makes us natural partners. And it would be good as, sort of more broadly, funders and governments are talking about, expanding partnership models or changing partnership models, making transaction costs lesser for countries, et cetera, that we also, as sort of these kinds of global networks, find more ways to build sustainability together and find more ways for that kind of real interconnectedness, because I'm assuming that at the community level, it's probably quite rare that our colleagues and the people that they serve are able to so, neatly distinguish as we might be able to in our strategies, what the value add of AMR work or HIV/AIDS or TB or education or, access to medicines, what those all are. And I was interested by the access versus excess comments from Nefis just before. But I think finding that collective value add as global mechanisms for our community-based partners and how we work with them and for them is likely an important adjustment that we need to make to our approach on partnerships. How we do that, Andrea, I'm not sure. Anna, I'm not sure, but building models that last and can scale with integrity and are accountable to those whose expertise we seek to uplift is a good thing for funders to know and to be flexible, but it's also really good for us to reflect on, I think, how we can do that going forward. Thanks.
Thank you so much for that, Katie. And then over to you, Nafis, your key highlights on partnership, and also if there's any point that you'd like to raise before we close this panel.
Yeah, so all of us know that it's a crowded funding landscape and AMR is being squeezed out. There are a lot of people, but even within AMR specific funding, there is this frequently a narrowed approach to innovation, and all the technological platforms, the diagnostic tools, they gain traction, and we need to stop this marginalization of social innovation. And we need to this constant undervaluing of lived experience, this top-down model of AMR. This must be stopped. And ReAct has many examples where it has proven that. Apart from ReAct, welcome-led projects, superheroes against superbugs that happen in India, in a South Africa Kailista program, all of these have worked wonderfully well. So my concluding remark will be to build a community-led AMR knowledge. We must listen deeply, fund fairly, and co-create as bravely as possible.
Great 3 takeaways. Thank you so much for that. And finally then, Professor Shuku, 1 year since the high-level meeting, the Global Leaders Group, you have this as your responsibility, I would say, as global leaders. What are your main takeaways, and what new partnerships is it that we need to build?
Well, the partnerships are already enough, to be honest. Maybe we should rephrase and say, how do we ensure effective partnership, and not just partnership in name and on paper? I think at the global level, the usual suspects will continue to engage them, will continue to engage the regional bodies, the group of 20, G7, the African Union, and so on and so forth. We need to continue to engage them. But on the other hand, there are many partners, such as ReAct network, for instance. I don't think we've actually exploited this opportunity that much. So going forward, I also advocate to the GLG to continue to work with groups like ReAct network. It's very important to make use of people who have already started the work and can only build upon what they've already achieved. Now, I'm talking about funding. Of course, there are many bodies that are already into it, but what is important is to increase the funding for things like community work, community-based interventions. There's a lot of support, which is not wrong in actual fact, in terms of research in the laboratory and so on, in terms of surveillance. But there's also need for the social component, because we're all doing this thing for the people. And if we don't engage the people who reside in the communities, then in the end, it will only be like, an academic enterprise. So apart from the well-known funders, there are things we can do at the local level. Have we involved service clubs like Rotary International? They do have ways of getting funds, and they could be interested in this kind of work. Have we, for instance, looked at local philanthropies, local companies that can do corporate social, work, corporate social responsibility? Well, my final word is good to make money, good to get money. But more importantly, how do we deploy the money? Are there more efficient ways of using the available resources? So that's what I'm leaving this audience with. Are there more efficient ways of deploying available resources? Thank you.
Thank you so much for several good and important insights to the to close this panel. And now, Andrea, I will leave the floor over to you. I think, and hereby thanking all the panelists. And over to you, Andrea.
Thanks, Anna, and thanks to all the panelists. This was a very intriguing and mind-opening, I would say, discussion. I've noted down quite a few things, a few papers here, taking notes from what each of you said before. But just to highlight a few points, perhaps it's the co-creating approach, really setting priorities together with communities. From local to global, I think it was mentioned several times, the accountability part as well, how to also ensure to keep policymakers, in that case, accountable, understanding the context and really applying that type of content and adapt a specific project to that context. And last but not least, perhaps one of the last points that was mentioned, it was like to find an efficient way for opening resources. But those were just a few of the takeaways. I want to mention that we're also going to write a report after the webinar, but there are a few questions indeed from the audience, and my colleagues have helped me also selecting a few of them, and I'll just open to all the speakers and panelists to answer whoever wants to answer the question. So the first one, actually, there were two questions on AMR stewardship, both from Menyanga Abu and from Mark Bayot. I'll read the second one, which perhaps is more comprehensive. So community engagement is indeed an essential dimension in fighting, preventing AMR as any other health issues. How are you able to engage through community engagement with health professionals, both at local and national level, and how could you achieve change at the prescribers' side as well? So very much into the stewardship part, but also like what can we do? How can we see a change? How can we build that change? And I want to invite, again, all speakers and panelists to answer. We have a few minutes, so just feel free to raise your hand and I'll give you the word. Anyone who wants to take this one? Yes, Professor Chuku, go ahead.
Yeah, that's a beautiful question, very important. It is all about, in the end, whether we're talking about the animal sector, human health sector, it's all about the human being. And so once we're able to discuss with members of the community that it's all about them, it's all about them, and use examples to illustrate why it is about them, what harm can come to them personally at the personal level, I think they will begin to understand it better. Thank you.
Thank you. Thank you so much. Anyone else who wants to answer this question? Yes, Philip, please go ahead.
Thanks, Andrea. I think that's a fantastic question. I think it kind of helps us to reiterate the importance of the systemic dimensions of antimicrobial resistance. Particularly, we are dealing with a broken health system in many parts of the world. We don't have universal health coverage or universal health care, depending on which is your favored terminology. And I think this cannot move ahead without the primary healthcare community being engaged very remarkably. We don't have the right tools and resources to actually translate many of the interventions that we have at the tertiary level to a more primary healthcare level. So some of these interventions can actually lead to better primary care also. We have seen, I was also a part of the Antibiotic Smart Communities project, and so long time back. So the idea is that once you are mobilizing the community stakeholder groups, informing them about antimicrobial resistance, it will definitely translate to better understanding and accountability from the primary healthcare system, also the local stakeholders, the local decision makers involved, access to care for acute infections. So all of that will actually systematically improve. So this is a community engagement is a form of accountability, and it's a form of applying pressure to the local decision makers, especially when there is greater democratic decentralization happening. So just to conclude, I think the question reiterates the importance of us to actually acknowledge that we are working in a broken primary healthcare system in countries without universal health coverage, and we have to take initiatives to overcome that. Back to you.
Thanks, Philip. Very comprehensive answer. Katie, and then I'll move on to the next question with just one person answering. Yes, Katie, go ahead.
I think just really quickly, I think, we're facing such such a seismic shift in the global health sort of funding landscape and, so many questions around, reframing the architecture. And I think a lot of that has focused on, what the transaction costs are for governments, what the, how to make implementation of external funds simpler, et cetera, et cetera. And when those high-level conversations talk about country-led, I think we have to push back a bit and ensure that that does not become like synonymous with government-led, right? And so it's as important as it has ever been in ReAct's 20-year history to be supporting those community experts and those community leaders that you do have within your network to engage in these future of global health conversations and dialogues at the national level, but also, at the international level, because recognizing simple things from your past that have proven to be exceedingly valuable, like the education models you talked about for AMR with, children and those kinds of things. It's really important that we don't lose sight of that as we're rethinking, sort of the global health architecture, and that we don't, lose sight of all of these ways in which and places that we've had impact. So over.
Thanks, Katie. Great answer. And this is also a very good segue to my last question from the audience about youth engagement. So several of you also mentioned education, youth engagement. So I want to ask you the question from Mohammed Sheshu Manir. Given the strong role of youth networks in advocacy, how can the next generation of public health leaders be more systematically included in national action plans on AMR? I see Mario was very prompt in raising his hand, so I'll give you the word for this last answer, and then I'll move on to the closing remarks. Go ahead, Mario.
Yeah, thank you. Yeah, of course, I was prompt because I wanted. This is a question, a very recurrent question with younger colleagues of mine in the AMR space. How do we manage to have to be included in terms of leadership as youth? And my response is clear. Leadership is not something someone is supposed to give you. The only way to achieve this inclusion is to take action, keep taking action, and keep implementing impactful intervention at your level, be it at the very grassroots level, but sooner or later it will resonate with other stakeholders, and you'll find yourself being invited to more engaging level. So that's the response I give to my younger colleagues. And I also want to take this last opportunity to extend a call to action about an action group, our action group on the continent. We have this action group about mapping and structuring CSOs in Africa involved in AMR at the community level. And we want to craft a unified report, a unified agenda that we want to present to the next ministerial conference. So in the coming weeks, we will send the link for the survey to gather data, more data from CSO representatives. So kindly help us gather this data to have something comprehensive at the continental level. Thanks, you.
Mario. Great answer and great call for action. We're looking forward to receive that link. But now, before letting you go, and I want to send a round of applause for all our speakers today until now. But before going, we couldn't end this webinar without hearing directly from the ReAct funding director himself, previous member of the International Interagency Coordination Group on Antimicrobial Resistance, ICG, Professor Emeritus Dr. Otto Karsch. 20 years ago here at Uppsala University, together with other passionate global health advocates driven by the urgency of antibiotic resistance, he founded the first global network focusing on antibiotic resistance and completely revolutionized the discourse around this topic and for global health overall. Professor Karsch will now give us some closing remarks and a forward-looking message. Otto, the floor is yours.
I'm sorry.
Yes, Otto, we can.
No, finally. Okay. Thank you so much, Andrea, for that introduction. But first of all, I would like to thank everyone for a very, very interesting webinar, and particularly the panelists for the great insights and reflections. It is really great to see how different paths for community empowerment and civil society mobilization is coming together. Because bringing about policy change and social action for this massively complex AMR issue takes a lot of time. However, for me, it seems that today we might be seeing the beginning of a real civil society mobilization and a movement. That's fantastic. A national action plan against AMR is not the government's plan. It must simply be the plan of the whole country and formally include communities in the core of the implementation. This is not only necessary, but it's also very cost-effective. There is an increasing willingness across the globe to participate, but governments need to provide a structure. In the core here is that access to effective antibiotics needs to be seen as part of the infrastructure of all health systems. Without them, systems will crumble. I will make no attempt to try to summarize this fantastic event, but I put down a few core messages that came through to me. It's obvious that the past 20 years have demonstrated that communities must be seen as active drivers of solutions and that innovative bottom-up approaches have proven their value and adaptability into different contexts. So looking ahead, the role of communities and civil society must expand, not as something nice to have, as Philip put it, but instead as a central, tangible part of AMR governance. Pilots need to become policy. Another key takeaway is that moving from awareness to system change requires embedding community models into policy and financing frameworks. Communities must be meaningfully engaged through formal partnerships, not only as implementers, but also as co-creators and accountability champions. Because one important role of civil society is that to ensure that leaders deliver on their commitments and to hold them accountable when they don't. As was said in the introduction, I was a member of the ICG, the Interagency Coordination Group on AMR, which delivered our report to the UN Secretary General in 2019. One of our key recommendations was to call for the systematic and meaningful engagement of civil society groups and organizations as key stakeholders in the One Health response to AMR at the global, regional, and national and local levels. It is clearly time for governance to deliver on that. In the report of the 20 years of community engagement, the report outlines a few concrete actions. One, to institutionalize community engagement in AMR governance with dedicated budgets. Two, to scale proven education models by integrating participatory learning into school curricula. Three, to strengthen accountability mechanisms by requiring transparent government reporting. And four, to build sustainable financing structures such as multi-donor trust funds. All these are not abstract ideas. They are actionable steps that governments, funders, and international agencies can take on now. If you look into the UN Political Declaration from 2016, civil society was mentioned twice. In the one from 2024, it was mentioned three times. We must work together to make commitments for engagement with civil society a much stronger part for the forthcoming ministerial conference next year and the UN high-level meeting in 2029. By then, not 20 years from now, commitments must have translated into visible progress on the ground, and I'm sure it will. The sustainable behavior changes needed to manage the antibiotic crisis starts with people. So, let us leave today with a shared commitment to increase our collective advocacy to put communities at the heart of the AMR response. Thank you very much.
Thanks, Otto, for your clear words, for really outlining the next steps in terms of empowering communities, scaling the vision, embedding it into policy, and really ensuring sustainability. We couldn't have closed this webinar in a better way. So thank you so much. I want to thank everyone for joining the webinar today. Really warm thank you to all the speakers from the opening remarks up to the closing remarks indeed. And we really look forward to collaborating with you all. So keep also tuned in our social media channels, and you will receive recording and more information in the coming weeks and months. Thank you so much to everyone. Have a good one.